Introduction. We are what we eat. We all know this motto. But what should we eat? There are so many mixed messages from scientists, industry, and the media about what is healthy for us and what is not. There are also so many different alternatives. Most of us are far removed from eating what we harvest or produce, and we are busier than ever, often eating quickly away from home. At the same time, we are worried about our health, and with reason. Cardiovascular disease is the #1 cause of death in the industrialized world, and risk factors such as diabetes and obesity are on the rise. In fact, worldwide obesity has more than doubled since 1980. In OECD countries, more than 50% of adults and 20% of children are either overweight or obese. Changes in food habits and messages. Since the 1960s, lifestyle changes and increased economic means have led to changed eating habits. Many times, we do not even know what we are eating or how it was prepared. Beginning in the 1970s, the oversimplified message was extended that fat is bad and can lead to heart disease. This led to the production of all kinds of low or no fat products. Unfortunately, the message was incorrect, often having us substitute good fats for sugars and other simple carbohydrates that are actually far worse for our health. In fact, not all fats are bad, only certain fats are. Other fats actually have beneficial qualities. How do we know what is good and what is not? Nutrition is complicated, which is part of the reason that the message about fat was miscommunicated. In addition, specific food industries advertise the benefits of their particular product. Also, science keeps evolving. Although nutritionists may disagree about certain aspects, there is general agreement that eating well consists of eating nutritious, whole, minimally processed food that is as close to its natural form as possible. Evidence in support of a Mediterranean diet. The Mediterranean diet is characterized by minimally processed, nutritious food. It consists of consuming a great deal of olive oil, fruit, nuts, vegetables, and cereals, a moderate amount of fish and poultry, and a low consumption of dairy products, red meat, and sweets. It also includes the moderate consumption of wine with meals. A 2013 study of 7,447 adults with high risk factors for heart disease assigned participants to one of 3 groups, 2 following a variation of the Mediterranean diet and a control group following a low-fat diet. The study found powerful results. A 30% lower risk of developing heart disease in participants following one of the Mediterranean diets than those following the low-fat diet. Conclusions. Eating well and enjoying food does not have to be rocket science. We simply need to eat natural, whole, scarcely processed foods. The Mediterranean diet offers a nutritious, varied, enjoyable alternative with compelling evidence to boot for healthy outcomes.